Good afternoon. This is Dr. Bhupesh once again from Dr. BKM Institute, and today we have got this topic which is of speaking. Again, these are the topics which are created by different institutes, like in this case, it's by the owners, some institutes, so we appreciate. But at the same time, please understand that in exam, a small task like this will not come. There would be good enough data that will give you 5 minutes for the explanation. So there would be lot of things that would be given over there. Sometimes it can be small, and in those tasks you might have to repeat. Again, I would like to repeat few things. First, you will get 3 minutes for the preparation, and it's only audio recording. These are the important points I always would like to say. That means you are not judged for your video. That means you have no marks for your facial gestures, and the examiner that is sitting in front of you, he is just a patient. So please do not consider him as an examiner. Be a nurse and treat him as a patient. So this is a task that has been given. This 41-year-old patient has been admitted for the third child by C-section, and also she has been diagnosed with rheumatoid arthritis. She has severe pain in her wrists and shoulders and is feeling very fatigued as the pain is disturbing her sleep. So she is worried about breastfeeding whilst using any medication. Respond sympathetically to the patient demands and question. Explain the reasons for oral medication prescribed by the doctor and try to persuade the patient to take this medication. That means you have to convince the patient for the medication and reassure the patient of the safety of the oral medication. Try to calm down the patient by suggesting other ways to cope up with the pain. Okay, so I'm just going to repeat this task for you. आपके सामने ये task रहेगा, तो मैं आपके लिए एक बार बोल देता हूँ. Good morning, my name is Bhupesh. I'm your charge nurse. So, how are you feeling now? Well, nurse, I'm feeling very bad. As you know, I'm here for C-section for my third child, and on the top of it, I have been diagnosed with rheumatoid arthritis. I'm really worried. Well, I'm sorry to hear that, but don't worry, you are going to be absolutely fine, as doctor has prescribed you certain medications which will help to relieve your symptoms. See, nurse, I want to say that I have a lot of severe pain in my wrist and shoulders. Also, I'm feeling very fatigued because I have not been sleeping because of the extreme pain. So I'm really worried, but at the same time, I do not want to take any medications because I think it would be disturbing my breastfeeding, because I want to breastfeed my baby after the delivery. So I don't want to have any medication. Well, I do understand what you mean, that there are certain medications which have side effects, but in this case, I must tell you that these rheumatoid arthritis pain will not go away without any medication, because in case of these arthritic pain, as you are already saying me, the pain is severe. That means it will not go away by simple methods or by naturopathy. So please understand, you need to take your medications. Only then your pain would be relieved, your symptoms would be relieved, and you would be able to bear the pain of C-section, and otherwise also you would be able to recover soon. So please understand, these medications are very important. But nurse, you are not understanding. I might have certain side effects of the medication, then I have to deliver the baby, I want to breastfeed the baby. So these medications can have ample side effects. I'm really worried. Well, trust me, as I have already told you, doctors are experts and they prescribe you the medications according to the medical protocol, which in itself is decided after lot of research. So it is not given to you just like that. There is lot of research over every medication before it is prescribed, as doctor has great knowledge about these things. So if he has given you these medications will certainly help, and you don't have to worry. You need to trust the doctor, and doctor is an expert. He knows what medication can have which kind of side effects. So obviously he will not give you any medication that will have any side effect for your baby or for yourself. Well, nurse, I trust doctor, but I'm really worried, because, breastfeeding, as you know, that, if I would have the medications in my blood, then it will obviously go through breastfeed to my baby as well. Well, as I have already told you, I would like to repeat that these medications will not have any side effect, as doctor has prescribed you only after his experience, and also there is lot of research before the decisions are made for every medications. These medications are well allowed, and considering your rheumatoid arthritic pain, it is important to be taken medications, otherwise you will have even worse effects. So please understand, we are saying it for your convenience, and you must take the medications on time. Okay, nurse, but how about other things? I have heard that there are other naturopathies like capsaicin, which relieves pain. So I would like to have something. Well, you can also use those therapies, but on the top of medications. It is not like that you can leave the medications and can take the naturopathies, because it will not relieve your pain. because in rheumatoid arthritis, again, it is an inflammatory disease and the pain is massive. So doctor has prescribed you anti-inflammatory medications that will relieve you of the pain, and at the same time you can use other ways to cope up with the pain. First of all, the most important thing that you can use is hot and cold pack. So what heat does to the body, it provides the thermal power to the body, and you get, the blood is circulated well, and in this way your pain is relieved. At the same time, cold pack helps for the vasoconstriction. That means it decreases your nerve pain as well. So these hot and cold packs, when used alternatively, are very effective for relieving the pain. Second thing is that you should definitely call your friends or your relative, because at this point of time when you are about to deliver a baby, and also on the top of it you have been diagnosed with this problem, which again would be relieved by the medication. But I would like to tell you that a support of a friend or a relative can do miracles. So if you have any friend, any support or relative who can come, then it would be really good on you. So I would really like to encourage you to call one of your friends or relatives to come here and to support you. All right, nurse, my friend just lives nearby. I'm just going to call him, and he will come, and he will join my husband as well. And I think I would be feeling much better. Yes. So you're already having husband, which is a great thing, and he's here only, which is very very nice. And you are also having the support of your friend who lives nearby, so you can call him as well, and he would feel calm as well. Even your husband will feel more encouraged and more positive. Well, yes, nurse, I do feel the same. I think there should be. So I will call my friend. And nurse, I'm really worried, that what will go, that when can I go home? I'm really worried. Well, we would like to discharge you very soon after the C-section if everything goes fine. But at the same time, I would like to tell you, you need to be reviewed by the doctor after your delivery. So only after then doctor will make decisions. So at this point of time, when we are about to go for the delivery, so please understand, at this point of time, talking about the home and other things, it is not really calculative at the moment. So you need to have the patience. Please understand and try to keep yourself happy, and don't worry about the medications. These medications will take you out of the pain and you will feel much better. Is it all good? Well, yes, nurse, I think that's fine, but I'm really worried. you know well, I do understand this anxiety will always be there, but we are here to counsel you, to support you for everything, and to encourage you that everything is fine and there is nothing to worry. It's just the circumstances which will pass by very soon. So it's just for this moment you should try to be positive, and we are here to support you. If you need anything, please let us know. There is a buzzer beside your bed. If you need anything, please press the buzzer, and we are here to help you, and we assure you for the best services. All right, nurse. Thank you. All right, take care. Bye bye. And at the same time, there is a little bit confusion in these kind of topics. As I'm saying, in exam it would be much clearer. The 41-year is in the hospital for delivery, so it should have been there that a 41-year patient in the hospital has delivered the third child. ऐसे होना चाहिए था, तभी ये घर जाने की बात करेगी, नहीं तो ये घर जाने की बात क्यों करेगी? तो हैज डिलीवर्ड होना चाहिए था, हैज डिलीवर्ड अ बेबी बाय सी सेक्शन. तो ये छोटे छोटे टॉपिक, अगेन आई नो आपको थोड़ा तंग करते हैं, but at the same time, in exam it would be much sorted and there is nothing to worry. This is Dr. Bhupesh from Dr. BKM Institutes. Please listen to this recording 5 times, maybe 10 times. Everything adds on, क्योंकि मैं आपको वैसे बोल के दिखाता हूँ जैसे आपको पेपर में बोलना है. लेकिन अगर आप सिर्फ 2 बार सुनोगे, 3 बार सुनोगे, it will not be that effective. So please listen to it 5 10 times, एंड यू विल सी द मिरेकल्स हैपनिंग, बिकॉज आप मेरे जैसा बोलने लग जाओगे अपने आप. बिकॉज एक चीज को 10 बार सुनेंगे तो हम उस जने के जैसे बोलने लग जाते हैं. वी लर्न फ्रॉम ईच अदर. So please try and listen to it 5 10 times. This is Dr. Bhupesh once again from Dr. BKM Institutes. Thank you. Please like, subscribe and hit the bell icons for the free OET coaching videos.